I will give the floor to Dr. Klepikov for his presentation, and after to the members for Q&A session. Dr. Klepikov, the floor is yours, please.
Thank you so much. It's really an honor to present you an update on situation in Ukraine in regard to HIV/AIDS. So Ukraine is so heavily affected by the war, and we see that not only military infrastructure, but actually civilian people are the most affected, with 15 million people moved or within Ukraine as internally displaced people or as war refugees abroad. Health infrastructure was also so heavily damaged and affected, with 2,285 facilities affected. So it's a huge impact on health, and we appreciate European Union and Europe's overall support to Ukraine in order to sustain health. Main funder with EU fund money is the Global Fund to fight AIDS, tuberculosis and malaria. This is a major contribution along with EU direct support to Ukraine in order to sustain health of people in the situation of war. We see that the main outcome of this funding is actually that HIV and tuberculosis situation is under control even within the war. It's a very unique situation because everybody speaks about sustainability, and Ukraine demonstrated resilience and sustainability in the time of the war, where external challenges and constraints are enormous. You see several graphs here. One is that showing that decline in HIV positive cases, while we still increase number of tests in the country. Another at the bottom, it's a specific program on opioid agonist treatment for people who use drugs, and you see the drop, the only drop, the red line when the war started, and then program continued with a further increase in services. We didn't manage to lose clients and patients during the war because of the combined efforts of civil society, community, and the government. It's important that health system is different now, and I appreciate the visit of the SANT committee led by you in April this year. So you saw this with other members of the committee with your eyes, how situation is different. The main differences I would like to present that we now have more mobile medicine. We have continuous serving people with in the territories affected by the war. We are using mobile clinics with integrated health care services in Donetsk, which is so significantly occupied, Kharkiv, Kherson, Zaporizhia, Mykolaiv, Dnipropetrovsk region, going to the areas where there are no hospitals, no doctors, no nurses, still providing services. So this is a new model piloted in Ukraine, and it will be relevant during rebuilding stage as well. Not waiting for patients to come, but proactively reaching those, especially people with disabilities. Also, you discussed at the previous session, they cannot move and they left behind. So this is the only way to provide integrated health care to them. Another thing is getting digital. It's so critical to apply technology. It's like on the battlefield, we cannot win the war with old means. The same in the healthcare. We use apps, digital social worker. You see on the screen people hiding in the subway basement, in the metro during air raid sirens. So they still use mobile devices, including for seeking health advice. Not only HIV, of course, also mental health, other critical services they need, sometimes during curfew, sometimes during air raid sirens. And it's amazing that sometimes digital technology works where human cannot work, like at night or during air raid sirens and Russian attacks. So it reaches through telemedicine over 77,000 most at risk groups. We also provided several recommendations how we can improve Ukrainian accession to EU. There are 6 areas we are highlighting in the areas of drug policy reform, modernization of drug treatment, also decriminalization of sex work, accelerating reforms, penitentiary healthcare reform, accelerating reforms in the area of human rights, in particular LGBTQI people rights, decriminalization of HIV exposure and transmission. We count also on EU policy to help Ukraine to ensure conversion of the standards and being aligned, completely aligned with EU standards. Another big area are global programs such as EU for Health, Horizon, other global initiatives. I particularly would like to highlight support from the Global Fund to fight AIDS, tuberculosis and malaria. As I said at the beginning, this is the most, during the war, it demonstrated its highest effectiveness and agility in response in providing emergency funding in comparison with any other donor. So EU is a major contributor to the Global Fund, and this year is a year of the upcoming replenishment. So we call on based on our experience, for 800 million euros to be replenished to the Global Fund later this year. A colleague from the Global Fund is also here, Françoise Wani, so maybe she can comment as well. Another thing, appreciation for EU, for Ukrainian facility mechanism, which gives critical support, and we expect that with joint efforts, peaceful future will be Ukrainian reality. We already used to be living under daily shelling. I'm coming from Kiev, and we face this even before I left on Sunday, on Monday, so heavy attacks. So it's so critical to find a peaceful and justful resolution of this war. Finally, I also would like to draw your attention to several reports. One is reports for Ukrainian health response during 3 years of the war. I will leave some copies there, and also through the presentations they will be available also online through the links in the presentation. And finally, I would like to say a big thank you for the SANT committee, because within the very big European institutions and big diverse infrastructure, you are the ones promoting and defending health. among other priorities. And it's so critical because we have competing priorities, and we know that security is getting high on the European agenda. It is correct, but it never should be a dilemma, health or security, either or. Because what we learn in Ukraine is that health is part of the security. Protection of health is part of the security. And if we talk about HIV, tuberculosis, these diseases know no borders. So protecting people from HIV infection and tuberculosis is contributing to the global European security agenda as well as health. Thank you very much.
Thank you very much, and thank you, Andriy, for sharing with the committee the incredible, extraordinary experience of Alliance for Public Health in Ukraine. We are extremely proud and humbled to be your partners as the Global Fund, and we are always very inspired by the way you advocate for the Global Fund through your experience in Ukraine. Perhaps building on your experience and speaking about what the Global Fund does in Ukraine, but also in over 100 countries in the world, you spoke about country ownership. And this is one of the key principles and one of the key success factors of the Global Fund, which is we are not sending people abroad. We are not an implementing agency, as one could call it. We are really investing through partners such as the Alliance for Public Health in the countries that are themselves leading the programs to fight HIV, TB, and malaria and strengthening the health systems. And as we do that with in-country partners, we support both the governments when it's possible and civil society and community, and that's something that I think Andriy has outlined very compellingly, because this is really one of the key reasons why we are, that makes us that enables us to reach the most vulnerable and to therefore achieve success among the most marginalized communities thanks to this work with civil society and communities. So I think that also speaks very, very nicely to the Global Fund model. And perhaps one of the third things I would highlight from your experience, Andriy, is the innovation, flexibility, and adaptability that you have exemplified in such an extraordinary way. And this is one of the things we are trying to bring to all the countries we support as well, by being as flexible as possible as a partner, and very much strengthening and supporting the innovations that are coming from the country partners themselves, so that they can continue to deliver the very important work that they do, even in context of conflicts or other challenging conditions, circumstances. So thank you so much for that. I would like to thank the committee for the opportunity today, and obviously commend you for the importance you are giving to global health and to the work of partners such as the Alliance for Public Health and the Global Fund. So thank you so much for the invitation. Perhaps to give you a bit of scale, and perhaps, Andriy, you mentioned it earlier, the Global Fund has invested approximately $1 billion in Ukraine over the last 20 years to fight HIV and tuberculosis. And I don't need to go into the results achieved because Andriy did it very compellingly already. But that gives you an idea of the scale and also of the sort of partnership that we seek to have. We engage in the country and we stick and we work with partners. Whatever happens, we continue to work with them and ensure the continuity of the programs, even in the most challenging circumstances. And all of that would not have been possible without the European Commission and the European Union. So I want to thank you for that, because without such a support, the Global Fund would not be able to do what we do, and therefore we wouldn't be able to support the work that you've heard about from Andriy just now. Since the creation of the Global Fund in 2002, the European Commission has contributed so far over 3.4 billion euros to the Global Fund. And if we take into account the full Team Europe, so the EC plus its member states, then together the contribution to the Global Fund would represent about a third. So you are absolutely at the core of our work, at the core of our successes, and at the core of the sort of programs that you've heard we are supporting in Ukraine. So I do want to thank you as European Parliament because you are the ones voting the EU budget and obviously also holding the Commission to account for its commitment to the Global Fund and to global health more broadly. Perhaps last point, Andriy mentioned the fact that the Global Fund is currently in its replenishment period. I mentioned the predictability. We engage with partners, we engage with countries, and we work with them over the years. And one of the ways we do that is that we replenish every 3 years so that we are able to commit to countries for the subsequent 3 years to allow them to develop the programs that are the most impactful. So we are currently replenishing for the period 2026, 2028. And of course, this is a very special period because there is a lot of disruption in global health financing at the moment, which is having a direct impact in the countries and communities we support. A lot of disruption in treatment, in prevention programs, in supply chains, in human resources. It's really complicated, and what we see is really a risk of going backwards. Because with infectious diseases, it's not that you stop and it's okay. You can come back a year later and find the infectious disease in the same place. No, you will find them very, very much further spread because they go very fast. Or they can go very fast. So it's with a certain urgency that I call upon you to continue supporting the Global Fund in such a context. Otherwise, we will be risking going backwards and losing all the progress achieved so far in Ukraine and other countries, losing lives and seeing the infectious diseases increasing massively again. The European Commission, at the last replenishment of the Global Fund 3 years ago, pledged 715 million euros, for which we are extremely grateful. And given the context and the needs because of the challenging conflicts, climate change impact, and other issues, as well as the disruption that we see in most of the countries we support, given the changing landscape when it comes to global health financing, we would be extremely grateful if the Commission was able to increase its pledge to 800 million euros for the aid replenishment, which would be a strong signal of leadership in global health, strong signal in terms of the partnership that the European Commission wants to have with countries and communities around the world. And hopefully it's something that can meet the bar of the campaign that I've seen outside the Parliament that says, invest in what matters. Thank you.
Thank you. Thank you so much, and thank you for coming. I know it is a special effort. I visited your country well, I think now it's 9 months ago. And I'll have to say that what impressed me the most was the fact that you, alongside with fighting a war which is fought in our interests, common interests, you actually managed also to keep up with all the work, making sure that you will be able to join the European Union, including all what you have told us here. And I just also want to say that, as you mentioned yourself, but I guess for us it's very clear that what you are experiencing about from being terrible and horrible, it is also showing and demonstrating in a very real way what is needed. And especially to think about health as part of our security policy and security thinking. I think that needs to sit with us, and you know it not by theory, but by trying it the very hard way. So very, very large respect and all the best for your country and our common collaboration. Thank you.
Thank you very much, and thank you for your continued advocacy and service in Ukraine's HIV response, especially in such difficult situations. And you mentioned really your resilience. I'm also in admiration of that. We are aware that the war has severely disrupted HIV and tuberculosis services, compromising treatment, prevention, and also access for displaced and vulnerable population. And you show it also on your presentation. I saw this with my own eyes also during the last mission that we had with the SANT committee. In that context, I would like to raise several issues. How can the EU help ensure sustained access to HIV prevention in Ukraine, especially to better integration with harm reduction, sexual and reproductive health and maternal health services? Also, given the risk of disruption and generally weakened healthcare services and, of course, continued stigma, what forms of support from the EU could be most effectively help maintain continuity of care for people living with HIV and AIDS? And the report also highlights barriers faced by Ukrainian researchers in accessing EU-funded programs like Horizon Europe. Can you elaborate on the specific administrative, technical or financial challenges encountered and what practical steps could be addressed then? And finally, but you mentioned it already, the Global Fund remains one of the most vital donors of supporting HIV and tuberculosis responses in Ukraine, with AIDS replenishment, and you named it also, aiming to raise $18 billion globally. How important is it really that the EU meet and the call to pledge at least 800 million euros? And how directly would this support impact Ukraine's capacity to restore services and save lives? Thank you very much again for your work.
Thank you, Dr. Klepikov, for joining us today and for this important report. I strongly believe that the EU can and must play active role in supporting national efforts to end HIV and AIDS in Ukraine, especially given the fact that the Ukraine is now an EU membership candidate. Today, across Ukraine and I would say generally across Eastern Europe, people who use drugs continue to be heavily criminalized. And even when life-saving HIV services exist, people are often too afraid to access due to the fear of arrest or criminal prosecution. And as Ukraine moves forward on its EU path, this is a crucial window of opportunity for us to step up and act and help. The EU must use the accession process to promote a shift in drug policy from criminalization to health and harm reduction. And this means the Commission, including DG Home, should ensure that human rights and public health-based drug policy are reflected in the annual progress report. And of course, we must recognize the devastating impact of the war on the mental health of Ukrainians. You know, people who have experienced this kind of trauma and PTSD, especially soldiers, are at much higher risk of turning to drug use simply as a cope mechanism. And these individuals need support, not a stigma. So I have two questions. In your view, what kind of help does Ukraine need from EU institutions to help and to facilitate reforms on drug policy within the EU accession process? I mean, is there political will at all at the national level for this kind of reforms? And second, Ukraine possesses unfortunately, unique experience on responding to crisis situations, including functional systems and resilience. So what are the biggest, how should I say, success and strength you may list, and which of that can be useful and applicable?
Dr. Klepikov, thank you for your presentation. We are impressed with your work. We could see that during our mission in April, and we know we can see how difficult, how horrible situation is. Ukraine is struggling with unprovoked aggression. We should underline this. You has the right to decide about yourself, your future. We strongly support independence of Ukraine and fair and constant people, and we hope to see you in the near future in the European Union. We are keeping fingers crossed for you. Thank you very much.